Good morning to everyone. I'm Terry Brooks with Kentucky Youth Advocates, and I believe we have a record number of folks joining us today, several hundred actually. So we really do appreciate your presence today. Kentucky Youth Advocates had a rare invitation several months ago from Casey Family Programs. Casey Family Programs, as they always do, is a real thought leader when it comes to kids and child welfare. They wanted to focus on the impact of the pandemic on the most vulnerable of vulnerable kids. And so they invited KYA to tackle that task with an emphasis on listening to the young people themselves, as well as other key stakeholders, and putting together sort of an analysis of what had COVID done to that sector, and perhaps more importantly, what lessons could be learned as we move forward. KYA and Casey Family Programs share a view that child welfare reform has to be a trilateral approach. We absolutely have to have the judiciary involved. We absolutely have to have the executive branch involved, and we absolutely have to have the legislative branch involved. One or two of those branches alone can't do it. So we wanted to symbolize that today, and the agenda that I wanted to just make sure we were all on the same page, so you would get a sense of what was going on. We're going to open with some brief remarks from Casey Family Programs. That's going to be followed by remarks and perspectives on the systemic reform of child welfare from Justice Deborah Lampert, Secretary Eric Freelander, and Lieutenant Governor Coleman. After that, we are going to take some time and give you about a 10 to 15 minute overview of the findings that KYA pulled out of those 7 convenings that were held throughout the state. After that, we have some key legislators to react to that report. And so, you know, the judiciary, the executive branch, and the legislative branch will have been represented. And then we're really pleased that that DCBS Commissioner Marta Miranda-Straub. Marta, I always still just want to say Marta, and I know I'm supposed to be more publicly respectful. So Marta has agreed to facilitate a discussion with young people themselves and on-the-ground leaders. So this is a longer Zoom than we normally experience. I know that's a test because we all have Zoom fatigue, but we simply didn't think we could cover the topic adequately without having all of those voices on. So again, we so appreciate all of you being here today. We especially appreciate our guest, and I will say that their bios will be posted, so I'm not going to take a whole lot of time doing those intros, so you can kind of catch up if you want to know where Justice Lampert served as family court judge. You can go to the link and find that out. So this would not have happened without the support and the vision of Casey Family Programs. And so we'd like to invite who I think of as Casey Family Programs Ambassador to Kentucky, Anita Shannon, to join us. I am not good on technology, Anita, so I assume you're somewhere on this screen. I see you. Are you in Seattle or Atlanta or somewhere else?
Hi.
Okay.
Hi, Terry, Dr. Brooks, Commissioner. It's a pleasure to meet you by way of Zoom. Good to see Shannon and so many others. Terry is most kind. I look to partner with jurisdictions all across the country so that we can still shamelessly from those of you who are closest to the work. And that's what we're looking to do here in Kentucky. I am in Atlanta. I'm actually, was born and raised mentioned Chicago, so a little closer, but I'm really happy to be in partnership with the state of Kentucky. We've done a lot of good work by way of DCBS with the judicial branch and the legislative branch of government, and we have more work to do. And I do think it's important to hear from the voices that we are here to serve. And so I'm just glad to be a part of this and to see so many people early in the morning. It's a pleasure to be here, and I continue to be happy to work alongside you. Thanks for having me.
Well, Anita, we richly appreciate both, not just your resources, but the ideas that you and your colleagues bring to the table. So we just want to emphasize the role that Casey plays in this.
Thank you very much.
Okay, so we want to move to some opening comments, some perspectives around the systems that we just have to pay attention to because of COVID, and child welfare leaps off the list of that. We have three folks who I have the deepest respect for. When I think about a visible and powerful force for kids, I think about the Lieutenant Governor. She seems to be approaching that task in such a brilliant way, knowing that we can't silo kids. So she connects justice and education and child welfare and health in amazing ways. So Lieutenant Governor, we're so happy to have you, and like for you to kick this off.
Okay, sorry, I had trouble getting unmuted. Do you think after all of these Zoom meetings over the last several months, we'd have it by now? But thank you so much, Terry, for putting this together. I think it's so important to see all of these folks come together. We have people from both sides of the aisle, from all three branches of government. And between that and what COVID has exposed, that all of us knew was hidden in plain sight, but now maybe the general public has a better understanding of, is the importance of taking care of our kids, and whether that is the child welfare system, whether that is our early childhood partners, or education in my case. It can no longer be denied that our economy literally depends on these services. And I have sang from that hymn book the entire time we were campaigning. And COVID has really made, I think, people stop and realize how true that is. And so we've done a lot. I can speak from the governor's office and for the governor's office of early childhood here in the education cabinet to help respond in these situations. And so I think it's really important that we continue to focus on the health and safety of every kid. It's got to be our highest priority as we reopen our child care facilities. The governor's office has understood that focus, and we worked with different folks, and we provided leadership and direction. And we created a comprehensive and sustainable prenatal to age 5 early childhood system that will ensure a strong foundation for all of our kids. And that's also the important thing here is we need to also focus on equity and making sure that every child is met where they are. We have provided so many opportunities for families to better understand the needs of our young children during these uncertain times. And you all are probably like me. If you hear the word unprecedented one more time, you're probably going to pull your hair out, but it is. It truly is unprecedented. We've collaborated with a wide range of advocates, and Terry, the work that you all do and the coalitions that you put together, I can't say enough about bringing these issues to the forefront. And so thank you for being a partner in that. We've worked with advocates. We've worked across agencies, and you're going to hear me use the phrase shattering silos a lot because we've got to shatter these silos and come together for the greater good. Oftentimes we get stuck in our little corner of the world, and we forget that we have partners out there that if we pool our resources and our efforts, that we can accomplish so much more. So a few things that we've done over the course of the pandemic and with the shutdown of childcare and in-person classes with schools. The Governor's Office of Early Childhood actually provided 3,300 family learning kits to families in need. It was so popular that by the time that those kits had gone up, they were absolutely gone within hours. And so the need is there and the focus is there. And so that's reassuring, but it also means that we have a lot of work that we have to do. Our community early childhood councils, they listen to the needs of the communities and they were given the opportunity to respond to those needs. So some of those examples are the see-through masks for local childcare and partnering to provide children with those early learning kits. We partnered with our advocates for the, and I quote, fragile ecosystem, the impact of COVID-19 on child care providers. And then findings from that study are being used to inform policy as we move forward. Because it's really important that, again, we have to listen first and foremost, but we also have to act. And so all of the fact finding that we do in building these relationships and uncovering new information has to be turned into action. Otherwise, we're all just sitting here talking on Zoom, right? And so making sure that we use that information to inform our policy is really important. We have been very focused in Kentucky on building cross-sector systems to support the local communities, drive our commitment across the state. And to do this, we have to continue to engage stakeholders, but also bring new stakeholders to the table in innovative ways. You know, the innovation is becoming more and more necessary as we move on, especially through situations like this. So, you know, the opportunities like this help us to promote what we all, everyone on this group today would I think, agree is a unified message that our children and our families have to be our priority in the Commonwealth. We have to continue to look for innovative platforms for peer-to-peer learning. We have to have best practices that we research and share. And we have to explore how we can intertwine our funding and shatter those silos that exist in organizations and across agencies in state government. Because when we do that, we can increase our efficiency and we can pool our funding resources and be able to provide even more than we had been able to before. Sometimes all that takes is a simple conversation and a partnership and folks who are willing to come together and put individual agendas aside and work for the greater good of our kids and our families in Kentucky. So I'm honored to be here today. Terry knows what a fan I am of the work that KYA does. It is always been a mission to me in different roles, whether I was a teacher or a basketball coach or a lieutenant governor or the Secretary of Workforce, Education and Workforce Development. What folks don't mention enough is that while this is really, really important for our kids and our families, it is absolutely a workforce issue. And it's something that we have to make sure that we address in Kentucky to be able to move not just our families forward, but our economy forward as well. So thank you so much for the opportunity to be with you today. And I look forward to listening and learning from all of you. So thank you, Terry.
I'm unmuting myself. What I said, if you didn't hear, is thanks, Lieutenant Governor. I hope you know that we have such a respect for your head and your heart when it comes to kids. So I'm a little awkward because the Lieutenant Governor just told me I could not use the word unprecedented. But really what I wanted to tell you is that before this Zoom call started, Justice Lampert shared a picture of herself on a skyline, kind of a zip line, and it was unprecedented because I'd never seen a Supreme Court justice on a zip line. So I'm still in awe of that. Justice Lampert, as we said in the opening, we firmly believe that child welfare has to be beyond DCBS and CHFS. Certainly legislators are involved, but the judiciary is such a key element. Your background as a family court judge, I can't imagine anything being more valuable than that in your current perspective. So thanks for joining us in the midst of your busy schedule. And the floor is yours, Madam Justice.
Thank you, Terry and Lieutenant Governor, and everyone who's participating here today. I think that I have been selected to help our court with this project of improving our child welfare system and educating our guardians ad litem and parent attorneys and so forth because of my experience as a family court judge. And you don't have to read my bio, it's very boring. But I was a family court judge for several years at Pulaski, Lincoln, and Rockcastle County, a very busy circuit. But I found that job to be very rewarding, as anyone I think would, to have that direct contact with children and families, and to value that family bond and sense of community. The Supreme Court, of course, like everyone's been pretty busy lately trying to adjust to the circumstances around COVID and remote hearings and so forth, but I'm very pleased to remind everyone that our courts have never closed to child welfare cases. We can and will and must look at the numbers that have declined certainly since COVID has come into being, but we want to stress that under our new family court rules, we have recognized that anyone can file a petition in dependency, neglect, and abuse court alleging that a child is being abused or neglected or is a dependent child. So while we recognize and understand that our social workers are continuing to work hard in our state, they're doing so under unprecedented, Lieutenant Governor, circumstances. And for those of you who may be participating in today's forum who are private citizens or parents or concerned folks about the state or nation, you have the right to file a petition in any court in Kentucky alleging the abuse or mistreatment or dependency of any child. I'm also anxious to learn from each of you and happy to listen. And my email address is deborah.lambert@kycourts.net if you need to reach me. Not on any particular case, but on policy issues, I'd be happy to talk with you about that.
There we go. Thank you, Justice Lampert. So, you know, I've told Eric Friedlander, just forget all those business cards. Just put Eric Friedlander, comma, rock star for kids, because that's what he is. The thing that I want you to know about Secretary Friedlander, there's a number of things that I admire, but I don't think anything has impressed me more than what I would call responsiveness. During this particular pandemic, every time we have identified an issue, whether it's about kids aging out of care or issues with food stamps, we contact him because Eric and I talk early in the morning. We're early guys. And inevitably by that afternoon, Governor Beshear announces that they've taken care of it. I just got to tell you, I have not ever seen a level of responsiveness that is close to what we're seeing. And lots of folks get credit, but no one gets more credit than Secretary Friedlander. Eric, thank you so much for joining us today. And I and everybody else welcome you, appreciate the work you do, and we're anxious to hear your perspectives today.
Terry, thank you. Terry, you were actually one of the first folks I reached out to when I was coming back to Frankfurt. I will say that it was not a worldwide pandemic, was not in my plans coming back to CHFS. But working across systems, working across departments, particularly on child welfare was. And we are, we've come through a lot. And when we think about our response to COVID-19 and what's going on, I actually call it a tri-pandemic, right? It is COVID-19, certainly. We've also then, for years, been dealing with what I consider to be a pandemic of drug use and opioids. I also know that we also now see across the country that we again, for years, throughout history, have had issues and a pandemic around race and racism. So those are three things we are going to work on in the cabinet. That's where we're starting from. So as we look at that, we're talking about, you've heard some folks talk about building back better. You know, we have broken everything in the cabinet in response to COVID-19. Everybody's working from home now. We didn't think that that was possible in the cabinet, but that all happened within a week. I have a fantastic team at the cabinet that has done a tremendous job. So when you call me with an issue and then I say, hey, can we take care of this? It's the group of folks here that have really worked on that. So just to kind of give a brief sort of overview in terms of the response, with childcare, we tried to provide some funding because of the closures, with what we called hero bonuses for the folks that did the limited duration. We've done some emergency regs on childcare. We provided some funding for childcare. I think it's around in the 90 million, which is not enough, right? Nowhere near enough to keep our capacity at the same level that we've had it. We're very worried. I'm very worried about capacity. We did limit a group size to 10. That's been a very controversial thing that we did. But as we look at what our most important thing to do is, to save lives. And when we had our long-term care side, we had a medical ethicist with us that said that absolutely was our first order of business. We've issued probably about, with the pandemic EBT, for children who are not getting meals in schools, we have over 500,000 children that we're serving through there. We've increased our SNAP enrollment by over 100,000. We've increased our Medicaid enrollment by a couple of 100,000. We've been very, very aggressive about getting people into services to support them through this time. Our SNAP, our pandemic EBT, that supports local grocers and folks like that. The Medicaid supports our healthcare industry. If we didn't have Medicaid, our entire healthcare industry would collapse. But people need those services in order to get through these times. We're looking at some issues around increased overdoses and some increased social pressures. So we changed how we do things in terms of behavioral and telehealth. We've made just quick and drastic changes all the way through to First Steps programs, to hands. We've talked through some of those things. We now have telehealth parity in hands with in-home visits. We're working very hard on all of those issues, but it's all of the systems. All of the systems have to figure out how to work together. The courts have been very good working with us and letting us know, particularly DCBS, and we've had some virtual court appearances. We had over 10,000 children in out-of-home care. That number has been declining as we've been able to work with the court systems to address some of the issues with permanence. We're down, I think, in 9,600. We've actually seen a pretty significant decline in out-of-home care. Is that going to keep up? I can't tell you. Is that a function of not having enough eyes on children in schools, and not necessarily having the same number of eyes on kids in churches, as we've seen some of our reports actually go down? We're at about the same level as we were last year for July, but July is when schools are out. So it actually, that makes sense to me. So we've got some real challenges ahead, but we're going to do things differently. We're committed to prevention. The Family First Prevention Act is something that we are working very hard on. We want to shift some of those dollars to prevention. We want to make sure that we keep children and families together to the extent that we possibly can. And I hope you all, some of you know Marta Miranda Straub, Commissioner Miranda Straub, and I was very, very fortunate to be able to lure her to be the DCBS commissioner. But I've lured a lot of really, really good folks. I feel like there's a really strong team here, and we will continue to pledge to work with everybody across systems, because that's how you have impact. We are working very hard. So I've talked about race and equity and social justice. We're going to be an organization dedicated to that. We're going to be an organization that's going to be dedicated to being trauma and resilience informed. I think of trauma as sort of the negative side, and resilience is how we come back from some of those shocks and stresses. So I put them together because we also have to be strength-based. So that trauma and resilience is a lens that we're going to look through as we figure out how we build our systems back. We have a very rare opportunity, and it's going to take all of us in the community. It's going to take the courts. It's going to take the legislature. We are going to learn, and have learned, so many things as we've broken our systems down. How we build them back is up to us, and up to us now. So I won't say unprecedented, but we have, with crisis comes opportunity. I think you said that to me. And we now have an opportunity to make our systems work for the folks they're supposed to work for, and that's the kids and families in Kentucky. And so I look forward to working with you, the courts, Lieutenant Governor, education workforce, because I think our systems can work together better, and I think our systems can work together for better equity and social outcomes. And that's what I'm here to do.
Thank you, Secretary Friedlander. Also, thank you, Justice Lambert and Lieutenant Governor Coleman. So the next part of this, as Terry had outlined, was a bit of a dive into the findings. We went through a process of engaging with a ton of different stakeholders, because we know that the importance is getting perspectives from folks on the ground. So I'll go through the findings from that research, and then we'll get into another panel and a panel after that. So just to back up, my name is Shannon Moody. I am with Kentucky Youth Advocates. I'm a Senior Policy and Advocacy Director here. And with the help of Melissa Collins and a couple of other key folks, we were able to get this research and survey work done and focus group work done in a very short amount of time. So I do want to say thank you again to Casey Family Programs as well. I'm going to go ahead and share my screen because we're going to go through some slides with the data, and we can go from there. So, sorry. Okay, so hopefully everyone can see my screen. Yep, thumbs up. Okay, so like I said, we wanted to start off by thanking folks. Casey Family Programs is a critical part of this work, and Anita is always so incredibly supportive, and I just appreciate her as a person. So I'm really glad that she is our Kentucky representative. Also, the Department for Community-Based Services, the Administrative Office of the Courts, Voices of the Commonwealth, and True Up Louisville were very key in making sure that we were able to get the surveys and focus group information out to folks and really gather that stakeholder input. And then obviously for all of the focus group and survey participants, we really appreciate them putting the time in. So we wanted to first think about, you know, what the child welfare system looked like prior to the pandemic. So we heard from Secretary Friedlander, Lieutenant Governor Coleman, and Justice Lambert about kind of how they responded, because they had to respond in a very short amount of time. Prior to that, what we were looking at was some pretty large changes happening within those systems already. The Cabinet for Health and Family Services was working on the implementation of Family First, and is continuing to work on the implementation of Family First, as well as the Child Welfare Transformation, and that in big part had House Bill 1 built into that from 2018. And those communities within the child welfare systems were also working more collaboratively together to more effectively serve the people within the system. But we also know that as a system, we were still struggling with caseloads and other common issues that child welfare systems historically have struggled with, including, sometimes inadequate funding or inaccessible services, depending on the region that we're in. So what we wanted to take a look at based on the survey was, and the focus groups was folks who were being impacted directly. So we wanted to talk to young people who were currently in care, aging out, or who had recently aged out, biological parents, kinship caregivers, including fictive kin, foster parents, and then also providers. And that included folks from the court, CASA, private child caring agencies, and residential agencies, and also MCOs. And what we were able to do was collect information from folks from 43 different counties across Kentucky in a very short amount of time, and both were in rural and urban areas. So the process was we hosted, KYA and with the help of Voices of the Commonwealth and other folks, hosted 7 virtual focus groups with targeted stakeholders, including those folks I had mentioned. And then we also, if folks could not join that virtual focus group, we also sent out surveys to continue to collect more responses. So within the survey, we had included a scale. And on that scale, we wanted to get a sense of, on a scale 1 to 5, 1 being strongly disagree to 5 being strongly agree, how would you respond to these questions? My average daily level of stress is higher than it was before the pandemic, and so forth. So I'm actually going to share a poll and ask for folks to respond to one of these questions just to see, because we are still in the midst of a pandemic. So if you will go ahead and answer, you should have a poll that pops up on your screen. We were just curious to see people's current level of the need for emotional support now compared to prior to the pandemic. And I'll give just another couple of seconds. It looks like our results will be pretty similar. Okay, so what did we see? Can folks see the poll results here? So, knowing that the people who are on this call are on this call or Zoom because you have an interest in the child welfare system, you're somehow attached to the child welfare system, or you're a concerned citizen. But likely if you're joining us at 10 a.m. on a Tuesday, this may be part of your job, which means that you may still have a job as well. Knowing that a lot of us who have access and the privileges that we do are still in need of more emotional support now than we are before the pandemic, I think says a lot about where we are as a state, as a commonwealth emotionally. This pandemic is taking a toll, and it has been taking a toll on many of us. So thinking about how 57% or more, really, of folks who would agree or strongly agree that they need more emotional support now than they did before the pandemic, think about what that feels like for our most vulnerable, including our youth in care, or youth who are aging out of care. So when we looked at the survey results, we saw that 95% of youth who were currently or more recently in care said that they needed, 95% of them needed more emotional support than they did before the pandemic. And if you look at our kinship caregivers, 43% more, foster parents, 33% more. So you're seeing that the emotional support is needed. And what we're also seeing is that folks who had participated in the survey said that they also needed more financial support as well before the pandemic. And again, 95% of youth who are currently or recently in foster care or kinship care were experiencing that pretty strongly. So that's something to think about as we walk through the findings. And also just keep in mind, if you are feeling some stress, some anxiety, some isolation as a result of the pandemic, if you are a young person who has experienced trauma, or you are raising a young person who has experienced trauma and may still need those resilience building skills in place, this pandemic may look a lot different for you. So in looking at the findings, we saw 4 major themes. And not only were we collecting information on, what wasn't working, what was difficult for people, we were also asking what has worked, what has changed, has there been any improvements on anything? So within each section, when we talk about those 4 themes, we're not only going to talk about the challenges that arose for people, but also some of the things that worked better. And also some of the things that we can carry with us and say, hey, we responded well to this. This might be a practice that we continue to take with us, even as things kind of go back to not being socially distanced or being less virtual. So this will not surprise anyone if you are a parent of a school-age child in Kentucky. We had a massive education system that had to move pretty quickly into a virtual setting, and they had to build the plane as they were flying it. So it's not a surprise that folks struggled with non-traditional instruction, and is also hopefully something that as we move into the new school year, we are also considering. So not just, connectivity issues, lack of internet access or lack of equipment for students, but also students not getting adequate staff support from teachers or other school employees that they needed in order to complete their homework or get questions answered when those questions arose. So we saw foster parents and kinship caregivers really struggling with trying to figure out how to navigate sitting down and doing homework with their child that they hadn't done in sometimes 50 years. So there were some frustrations and challenges with that. We also had some relative and foster caregivers that said they had no idea how poorly their students were doing in school, how far behind their students are doing in school. And we know that youth who have experienced foster care or kinship care are often more behind in their education as a result of those moves, as a result of the instability. And this is something that really came to light when parents were sitting across from their kids at the kitchen table talking through math problems. Another thing that we saw, and I think every parent probably could relate to, is that increased stress related to those dual roles. I'm wearing my teacher hat while I'm also trying to wear my employee hat and wear my parent hat at the same time. And there was a lot of stress and frustration that came as a result of that. And then especially from providers, there was discussion about concerns related to absenteeism or truancy. And providers had said that there was a perception that there were some increases in truancy as a result of the pandemic and schools not being able to contact the students. So some what we're calling silver linings or things to consider that were identified that maybe improved was we had a foster parent in particular, but we had a couple of foster parents talk about the benefits of that one-on-one instruction. So when the foster parents were able to sit with their kids, and particularly in a situation, there was a foster parent with a second grader and a kindergartner who talked about neither of them were reading very well, but she spent time every day working on the reading, and she had seen an improvement by the end of the school year. So that one-on-one individualized time really helped to increase the students' ability to engage in their schoolwork. Another benefit of moving to virtual during the pandemic was just the socialization that students were getting. when they were interacting with their peers in through virtual school. So the parents, foster parents, kinship caregivers had said that it was really good for their kid to just be in front of the video camera talking to their peers, just to provide some normalcy. So some solutions that were identified when discussed during the focus groups was really around the opportunity for maybe some sort of co-op or hub or pod. You're seeing all sorts of names around that, where you have peer groups of folks. So say you've got kinship caregivers, a small group within the same district who can get together, whether physically or virtually, and talk about the different challenges that their students are having, but also get together and do schoolwork together, or get together and kind of do some peer mentoring together. Some other identified solutions were peer support. So again, connecting people within the same school or people who are in the same situation like kinship care or foster care, and just helping them connect with each other around education issues, and just provide some peer support and ability to vent. And then also a very tangible solution was making sure that parents and caregivers had access to internet services, and making sure that finances were not a barrier to those supports and services. So again, it was pretty clear during the focus groups and interviews that mental health was a huge concern for both the young people who were, 18, 19, 20 years old, but also for the foster parents and kinship caregivers who were raising kids who were in this situation. When there's a lot of uncertainty, it breeds a lot of anxiety. So seeing an increase in stress, frustration, depression within the kids was probably not a surprise, but also was something that they had to figure out how to navigate and deal with. Isolation and anxiety was particularly present for those older youth who are aging out of care, who typically had those support systems and networks and socialization opportunities in place that were no longer there anymore. Inadequate access to some mental health services like teletherapy. There were some kinship caregivers and foster parents and providers who talked about access to teletherapy and telehealth, but there were some who said that either the provider wasn't very responsive, or they just were not able to ever make it happen. A lack of respite care was another identified issue, which when you're social distancing, that is a challenge and is going to be a challenge. So getting creative about that will be necessary. And then we saw an increase in behavioral issues within those foster homes and kinship homes because of that stress, frustration, anxiety, depression. So some silver linings that we saw was that you heard a lot of relative caregivers and foster parents say telehealth was better than nothing. They were grateful to have teletherapy or virtual therapy. The phrase that we continued to hear was, it's just not the same. Therapy virtually for FaceTime just did not feel like the same thing, which is understandable, but they were grateful for access to it if they had it. And then also virtual social supports. You had foster parents and kinship caregivers utilizing Facebook, utilizing other social media to help get with peer groups and just kind of vent to each other and talk to each other about what they were going through. Some identified solutions that we had seen was an increase in access to peer support. Again, making sure that people can connect to each other and just process, talk to each other about challenges and get that emotional support. Increased communication related to available mental health services. I think we need to know, and we need to make sure that our caregivers know that they can get access, and if they're struggling to get access, there is somebody they can call in order to do that. Communicating through various mediums frequently in times of crisis, so utilizing websites, Facebook, from any of the systems will be really important as we continue to adapt to this pandemic. Also, just in the future, having various means of communication can be really important for getting access to groups. And then providing those mediums through those hotlines or social media or websites. So another theme that we had identified was around a barrier to basic needs, and including placement instability, fear of falling ill, and financial hardships. These should not be a surprise to folks. Terry had mentioned youth aging out of care and being worried about not having placement stability. DCBS addressed that fairly soon, but there's still a lot of anxiety around that with the younger people. Falling ill and the fear of that was around making sure that not just older kinship caregivers, but kids who are medically fragile or people who were having to access court-mandated or court-directed visitation, they were worried about contracting the virus. And then also financial hardships. You did have, especially older youth who had lost their jobs, who really struggled to get access to unemployment and were concerned about paying their rent or getting groceries. Some things that worked, we didn't call it silver linings necessarily, but safety nets that worked. Food pantries, an increase in the Supplemental Nutrition Assistance Program that Secretary Friedlander had mentioned. And then some identified solutions were really around making sure that there's an accessibility to caseworkers or navigators to help folks who are dealing with this identify the supports that are already there. There were people who were talking about supports they didn't have access to that were available, they just didn't know about it yet. Also communicating through various means. Some of the providers talked about concerns around the staff and children in residential facilities contracting the virus. One of the ways in which we can ensure that continues to decrease is decreasing utilization of those residential treatment facilities for those who cannot be treated within the community. And then finally, the fourth was around navigating the systems. And we heard Justice Lambert talk a little bit about this with guidance and information put out by the courts around virtual hearings. But there were still some delays as a result of the pandemic. There were discussions around a lack of follow through from caseworkers or private child caring agency staff, which in a pandemic is likely to happen, but was something that folks had identified. And then also caseworkers and providers were concerned about the safety of children because they could no longer put eyes on them. And that was a big fear of theirs, is if they cannot see the kids physically, they are worried that they are not necessarily safe in every situation. So some silver linings that we had seen here was high quality, more consistent visitation through FaceTime or through virtual means. Some caseworkers were able to contact their youth, their young people more often. And we saw that, and other folks saw that as a benefit. Some other ideas is, thinking about how we keep some of those meetings virtual as we continue to adapt. And then again, that communication frequent in several different means. Also thinking about increasing tools and guidance related to relationship building and with biological parents. There were a lot of foster parents and kinship caregivers who had to figure out virtual visitation and were not necessarily comfortable contacting in the ways that they were contacting biological parents previously. So having some guidance around how to do that effectively is really important. And then finally, making sure that we have adequate staff and continue to recruit and retain DCBS workers so that our caseloads in the state are manageable. So I know I flew through that. I do want to let folks know that the report will be available and sent out in the follow-up. And if there are any questions about that, you can either send those via chat or send those via email with a follow-up. So one of the things that we wanted to make sure that folks heard and had an opportunity to hear from directly were from legislators. So we have asked actually Tyler Hunter, who's former chair of Voices of the Commonwealth. We had asked him to please facilitate a panel of legislators, including Senator Whitney Westerfield and Representative Joni Jenkins, to have them reflect on how they see legislators' role as we move forward with adapting to the pandemic. We also have remarks in a video from Representative Mead. He was not able to join us. He's actually traveling and was unable to join, but we'll be sending those in a follow-up as well. So Tyler, I'm going to pass it over to you if you would like to go from here.
All right, there I go. Well, first of all, I'm so glad and honored to be here with you all. I have to be honest, whenever Shannon asked me to do this, I thought it was going to be like 12, 20 people, but it's way more than that. And that definitely warms my soul here. So proud. I'm very interested to see where this conversation goes, or what actions happen after these conversations. A lot of times we have these conversations, but nothing happens. So I'm very interested to see what happens next. But again, just so glad to be here. So I'm going to be facilitating our legislature perspectives here with Representative Joni Jenkins, as well as Senator Westerfield, who I had was able to meet with them during our last session as I was trying to get our a bill that my group was sponsoring passed, which it did. Shout out to them. But yeah, so I guess starting with Representative Joni Jenkins, based on what you've heard from both the opening panelists and the data presentation, what is your gut reaction, and what are you driven to do?
Well, thank you, Tyler, and thank you for moderating this session of this great conference, and thank you for the invitation to be here. I think what the pandemic has shown us are things that we already knew, and things that I want to focus on in the next session are trauma. I think that so many of our youth in foster care have experienced great trauma early in life and throughout their life. And I think the dynamics of this pandemic with isolation and change in schedules and uncertainty has really fed in to triggering many of our youth. So I think that it's highly, it was not surprising to see that we were seeing some challenges within foster families of behavioral problems. But we've learned some things. We've learned where the gaps are. We've learned about the inequities. I know many families struggled with non-traditional instruction, and I am very hopeful that school systems, now having more than a couple of days notice on this, are going to do so much better and have a more robust curriculum for kids and their families. Telehealth has been very, very important. I still am not convinced that we are using telehealth to its fullest potential. So I'm looking for legislative ways that we can increase the aspect. I love thinking about that. Maybe for some cases, having caseworkers continue to communicate with their clients through FaceTime and Zoom and all those other things when it's appropriate, can cut down on travel time, and our caseworkers may be able to be more productive because of that technology. The big thing will be the budget. As most people, I'll remind folks that because of the pandemic, we only passed a one-year budget, which was pretty historic, I believe. At least I've been there forever, so it's the first time we've done it in my career in the legislature. So we'll need to come back in the short session and pass the second year of that budget. And I'm hopeful that while we know money will be tight, that we will look at some of these safety nets that were so helpful during the pandemic, and look at ways that we can put our money where our mouth is and really support families and kids.
Definitely. I like that phrase, putting your money where your mouth is at. That's something that not many of us do a lot, but I'm hoping that that's something, again, after this conversation, that we can start doing that as a state. Senator Westerfield, I'm going to ask you the same question. Based on what you've heard from both the opening panelists and the data presentation, what is your gut reaction, and what are you driven to do?
Yeah, thanks, Tyler. I appreciate it, and I appreciate KOA for having Joni and I on here this morning. This is a great panel, and man, the findings that were reported are, as Joni said, some of them are very unsurprising. Some of them were enlightening to me, and I wasn't thinking about how the pandemic has affected every variety of kind of home and household situations. So there were some situations in those findings that kind of caught me off guard and I wasn't thinking about, and never crossed my mind how the being shut in would have an impact on certain groups and certain families or certain arrangements. And that's eye-opening. In fact, I have shared bits and pieces of it with some of the service providers in the mental health community. I represent the Pennyroyal Center as an attorney, and they're part of Life Skills now, which is the CMHC in Bowling Green. Pennyroyal Center covers a little bit further west of Bowling Green. And I wanted to make sure they're aware, look at some of the things that these families are reporting they're having to deal with, access to issues. So like every other legislator, sometimes when you're a legislator, you're a hammer and everything's a nail. And you want to try to find a whole bunch of stuff and you think about a lot of different solutions. But Joni hit the nail on the head. The biggest consideration is where we can make budget allotments that can shore up some of these places and gaps that are there. I love the idea of I forget what the word was, the vouchers or whatever for internet access. One of the biggest issues that I've heard from constituents, and this was reported in the findings, was the access to the web. We're using NTI days, which were created in statute 3 or 4 years ago, not at all thinking about a pandemic. We were thinking about snow, a very temporary shutdown of schools and how to continue instruction if it's a lengthy amount of time like that. We weren't thinking about a pandemic. And so we should adjust how NTI days are built, but we need to be aware of what the impacts are on those families. And not everybody, particularly in my neck of the woods, I'm out here in North Christian County surrounded by cornfields. I've got internet access, but not everybody out here does. And this isn't only the rural part of Kentucky. So that's a big issue. I love the idea of building or having these co-ops or these pods, these groups, and whether or not they build organically among the students or among classrooms or among age groups or grade groups. I think building social interaction however we can and fostering that from a legislative perspective, either through permitting it or paying for it or providing or getting regulatory arrangements just right to allow it. I think we should foster that as much as we can. I mean, in person is the best. I mean, if I have one takeaway from the entire set of findings, it's how much we rely on being connected to one another. We're humans, and we've got to see each other and talk to each other and shake each other's hand and hug one another. And that physical connection is a huge part of us. And when we are missing it, it manifests itself in a whole slew of ways. And in this environment of this population of kids and families, we see how going without it hurts. And we need to find ways to build that back in as much as possible. And there are legislative things to do that. There are also some messaging things to do that. One of the things that I think is important, and this was shown in the findings, is communication. The people in the various groups talked about the confusing message from different levels of government, from the federal to the state to local. There are a number of things that play into that. Some of those are dumb political reasons. Some of those are structural failings that show just how badly government wasn't prepared for this sort of response. But I think whatever the legislature can do to clear up those lines of communication and make consistent the message, to understand what the rules are, what the recommendations are, and to know the difference between a rule or a requirement and a recommendation. I think it's important to improve those, to do sort of a post-mortem on this pandemic. And I think you've seen some of that in our committee meetings. A lot of the committee meetings have focused on the pandemic response, the good and the bad. I think it's important to clear up those lines of communication. Just yesterday, Justice Lambert's on here today, and I appreciate her service on the court. But I had a conversation yesterday with the Chief Justice. One of the troubling things right now, and this goes into the part of the findings people are worried about, those that are aging out. I know that there's a freeze on aging out right now, but there's still that anxiety and that uncertainty. One of the biggest things we have right now is and it started yesterday because it was the first business day after the court's order went into effect, but it's evictions. And there are a lot of these families that they've gone without paying rent for several months because they don't have income coming in. You've got landlords, some of whom can weather this financial storm. You got other landlords that are hurting financially because that was their income, and now they don't have that. But between the court's order and the governor's order that's currently in place, that I've told my constituents to take shelter under, freezing evictions, sort of. Just as again, to demonstrate this, district judges aren't all viewing those two orders the same way. They're not all carrying out and giving effect to those orders in the same way around the state. Even in West Kentucky, I've talked to district judges in counties about an hour and a half apart, and they don't see the orders the same. There are those sorts of issues that need to be cleared up. So there's a slew of stuff for us to do. We're going to be talking about COVID-19 for the next 50 years.
Definitely. Thank you so much for that. COVID-19 is something that will definitely go down our history books. I don't think I can survive another pandemic. I'm barely making it through this one. So hopefully not in this lifetime. But my second question, which you all kind of already talked about, was just, knowing that you all have some tough budget decisions ahead, how do you prioritize budget recommendations related to kids and families? But I think you all kind of both touched on that. So we have about 2 minutes left. So if Representative Jenkins, if you want to spend about a minute on that, you're more than welcome to do so.
Well, thank you so much. And, I am very, very much in awe of Eric Freelander, and I'm going to seek his counsel and ask for what his plans are for the cabinet as we go into the budget year. There are ways I think that we can leverage Medicaid money maybe a little bit better. I'm really excited about us becoming a family first state and putting more money into prevention. Some of the things that have been talked about as we've seen are, substance abuse has really kind of crept up during this, or continued on its upward spiral, I guess, during this pandemic. So I'm going to look for those experts over in the cabinet to help guide me.
Definitely. Senator Westerfield, do you have any last remarks?
Joni's right. We need to listen to the subject matter experts, behavioral health issues, substance use issues, how best to respond on any one of these fronts, hearing from the people that answered these surveys that you all put out there. This is invaluable information that every member of the legislature needs to see. And we need to be aware of these issues. The key is just making that a priority when we write this one-year budget. And then again, when we write the next 2-year budget right after that, there's nothing standing in the way except choosing to do it. And I think the evidence there that there's cause for making it a priority is right in front of our face.
Definitely. Well, I appreciate it. I think that the findings are very valid. As a young person who has been through foster care and adopted and is in that transition age range, it is very hard, mentally and socially not being able to see individuals and then, working to still advocate for young people in care while, going to school full time and 18 hours of summer courses. So it's not sexy, to do all this during the middle of a pandemic. This is not what I imagined my 20s being. So if I can go back to last year, I would definitely do that. But thank you all so much for all your hard work and dedication. Let's continue this conversation, not just on this platform, but on with each other one-on-one. Let's create other platforms. So thank you all so much. You all have a great day.
Thank you, Tyler, for that. And again, thank you, Senator Westerfield and Representative Jenkins. You all are no stranger to being champions for kids, and we look forward to working with you in the coming legislative session. So the final portion of this is actually a panel that Commissioner Miranda Straub has agreed to help facilitate, where we are hearing from Tyler again, but also from a kinship caregiver, a provider agency, from an alliance perspective, and then also a START mentor. So Commissioner Miranda Straub, if you want to take it from here, please do so.
Thank you, everyone, and thank you, KYA, for hosting this really important conversation I really love the different perspective and the energy that we all have about working together. I am Marta Miranda Straub, and I have been the commissioner for 3 weeks. However, I bring with you 47 years of work with families and children, both from an anti-violence, public health, violence prevention, as well as clinical expertise in mental health and substance abuse. That has been my practice, and about 25 years of executive leadership. So I'm incredibly excited to have been come out of retirement for this position. I am also in awe of Eric Friedlander. I hadn't had not a boss for a long time, but if you're ever going to have a boss when you're a Cuban hurricane, Eric Friedlander is the person to do that. So I'm incredibly honored to be here. What is really exciting to me about facilitating this panel is that because of my new leadership and because of the opportunity that we have at the cabinet, because everything has been blown up. We have done things that we never thought we could do. We are now pushed issues that we never thought we could push. So we have an incredible opportunity not only to improve child welfare and to improve services from the cabinet, but really transform the cabinet. So we are developing a 21st century DCBS because really our model is a 1950s DCBS. And the pandemic is going to help us do that. So what I like to hear from you are not are ways that you directly want to see transformed for child welfare, because we can do it now at this time where we could not do it before. So I am really excited to tell you that there's several pillars that we're going to be working on, and your input will be on one of those pillars, as well as the surveys we're doing with clients, as well as community partners, as well as staff. So we established social equity and social justice with our anti-racism work and poverty as a pillar. Also, child and family support, health, both behavioral, mental health, and substance abuse, as well as trauma and resilience of both clients and workers. We retain workers by addressing secondary trauma and compassion fatigue, and also being able to look at behavioral health and operations, implementation, and evaluation. We must be nimble, responsive, and create access and decrease barriers. So that's the big picture of what we need to do at the cabinet, and we're beginning to build over the next 6 months. So as you respond to the questions on the panel, please think transformationally. We don't want to put Band-Aids. Thanks to COVID, and we're able to transform. So it's an exciting time. This is complex and long-term, but we can do it. So I'm very excited to facilitate the panel. So the first question to the panelists is, what would you consider a transformation for child welfare that we have not been able to do before, but that we can potentially do now? What would be transformational in your opinion? Not just fix, not just retweak, but change drastically and or redesign as we move into designing a 21st century cabinet to respond to 21st century issues. Is my question clear?
Yes, this is Michelle Sanborn with the Children's Alliance, and we're an association of about 36 behavioral health and child welfare agencies. And I would say that I liken this pandemic to a natural disaster. When a tornado or a flood comes through Kentucky, the first thing we do is recovery and rescue. So you've got or response and rescue. Your first thing is that short-term solutions to really help those that are impacted. But then after you do that initial response, then you look at recovery and rebuilding. And when you do the recovery and rebuilding, you don't build the houses that were flooded in the same floodplain, right? You build them higher, you build them at a different place, right? Tornadoes, again, they knock down houses. You don't build them, with the same materials. You build them stronger, again, maybe in a different location. So I think we have to really focus and make sure our advocacy is around short-term solutions to make sure that we're supporting the current system, the families and the children and the workers that are here today in kind of a crisis mode. But then we also have to focus on long-term solutions that look different than what we were before. Why would we go back to something that didn't sustain during this time? So we must focus on family preservation services that wrap around the family, that treat the family. We're not picking up a child and moving them out and doing these things separate. We must focus on the family. We must give families the supports they need to raise and keep their children safe. Obviously, it's not working. This is a flood and a tornado. We can't get to these kids right now. So if we're not giving the services and the skills and the abilities to families before these things happen, this one or any other disaster, we're missing. So we've got to focus on the family. And then also we really have to look at telehealth. While it's definitely not the silver bullet for all, it has been very beneficial for some. And so allowing some of those expanded services to really help with scheduling, transportation. There's so many things that some of our young people have really opened up through telehealth. So I would say family services where we're focusing on the family, not the child, not the parents, but together, and then telehealth.
Thank you so much, Michelle.
Commissioner, my name is Norma Hatfield, and I'm with the Kinship Families Coalition of Kentucky. I'm a grandmother raising 2 grandkids. Just recently became the executive director of CASA of the Heartland, and I'm with the Grand Voices Network with Generations United. Given all of that, I'm going to share my personal opinion, not any organization.
Yes.
I love your question in this particular forum because I had to tell you that years ago when my grandkids went into the system, I saw some things that needed to be improved. And for all the great things that are there, every organization needs improvement. So I want to say that up front. But I tried to talk to anybody that would listen to me within DCBS, locally, in Frankfurt. And I even had a legislator tell me one time, it's too big. The cabinet is too big. They don't want to change. Because it's so big, it self-sustains itself. And I think that a lot of folks that are having to work their way through the system for the different needs that they have find those types of issues. It's if you look at how can you transform for the future, I would say start with the lessons learned that you have right now, because as somebody said earlier, we knew that a lot of these things that bubbled up from this presentation were already there. And I think the other thing that I would share is that I've been in working groups before, and usually as a kinship representative, I'm invited to the kickoff and everybody's all excited and everything. And then I don't hear anything until the outbrief. And then as a representative, as a person who's right there living all of this, I'm just told what I'm going to get. And I think we need to have more involvement. If you really want to service the customers that you have, you need to talk to them about what it is that what their expectations are. They may not get it all, but at least kind of bring some of that together. And I just wanted to mention two other things actually, and I'll be really quick. One is the vouchers or stipends for the internet. We have kids, we have caregivers. Kinship families are older, they're more vulnerable, and they are the highest rated caregivers within the state of Kentucky. And when we look at the systems within the courts for the kids, and we're looking at the biological parents, we need to look at these caregivers as well as part of a stakeholder when we make decisions on visitations and stuff, because they are vulnerable, they are scared. That if they try to, say anything back as far as visitations and their health, that somehow that's going to affect the kids. So I just hope that between the courts and DCBS and all the entities there, we kind of make sure we're doing a good 360 with all the stakeholders that are involved.
Thank you, Norma. Very helpful.
And speaking in regards to transformation, I would like to see just the overall support for and to our frontline workers. That's the front line of defense, those social workers, and they struggled providing services and support for the young people in out-of-home care settings because they were handling 60 plus cases. How in the world are you able to efficiently and adequately tackle 60 plus cases, therefore that they're not able to do so? So a young person being abused, or that young person's going without food or water, or the foster home family is not receiving the support they need, that puts a bad taste in people's mouths, and the job no longer becomes appealing, which is why we have social workers with 90 cases, because no one wants to do the job. And then we have a shortage of foster homes because, again, the job doesn't look appealing. There's no support, and it looks bad overall in the cabinet. No one wants to do it. Every year we lower the bar of standards. We're pushing work, and not education. So every year, the requirements to be a good social worker is dropped down every year. So again, that's an issue. So overall, supporting young people, again, we have the 1950 mentality. As long as you have a bed, food, and shelter, you're good. No, you're not good. You need a home, not just a place to lay your head. That's something that we don't have. But how do we get that? Do we give more money out? What do we do? Like, that's the hard part. And it doesn't make sense to me that, we can identify a home that is not providing the bare necessities, but we still can't pull their license for fostering. That's an issue to me. There should be a conversation about that whatsoever. So we need to look at and realign how our liners are how they're working and how they're being supported, because that's creating stress and strain on them. How are they able to balance a personal life and a work life? They're not. So honestly, I can't even blame them for neglecting their caseload, because they're neglecting themselves as well.
Right. Absolutely. Lamont, one of the things that I think that one of the reasons why I was brought to the table, besides that at any other time, I would never have been a good leader for the cabinet. I've never worked for governor in my life, is because the cabinet is serious and needs to transform how we do business. And one of the expertise's commitment is not necessarily to hire more social workers, but lower the caseload. We've gone now from 84 to about 38, and we need to go between 20 and 25. That's our goal. And second, compassion fatigue and secondary trauma are real and are hazards of the job. So addressing that with workers will help with retention and would also help with the quality of service. Without that, they leak or they leave. And then families have to start all over again. So secondary trauma is one of my pillars in my research, social research, as well as clinical. And I promise you that is one of the both mental health and behavioral health pieces around that. What you all have said is that the work, we knew what we were doing was meeting a lot of needs, but not the best that we could do. The gift of COVID is that we had to turn on a dime. We had to turn on a dime, do things we never thought we could do. So rapid crisis response to families in crisis and to children who are at risk. Being able to work from home and be able to do all that research from home, lowering the time that people call the crisis, our hotline, to 1.5 minute waits, not having a 4-hour wait, but be able to do a Zoom call. We've learned a lot. We know a lot about COVID. About 85% of our staff say they prefer working from home. They get a lot more work done. Our productivity and morale has gone up during COVID, which means we can provide better services. So the gift, the silver lining in COVID is that we've learned a lot, and we need to not only implement that, but design how we want to move forward, create more access, more community involvement. We are part of the community. You know, put the big C in community. We're not the only ones responsible. It's all of us, and we are a part of that. So very much on collective impact, very much on collaboration. So really, really appreciate it. This is right in line with what we hope that we can do. And this is just the beginning conversation. I'm hoping that quarterly we can continue to give updates and get feedback, because we need to stay transparent and flexible to the environment. This is no time to be rigid and go in a bunker. So thank you very much. Okay, well, I think we have one more panelist.
Hello, Commissioner, and everyone else.
Carmel?
My name is Carmel Stafford Klein, and I am the START Lead Family Mentor with the University of Kentucky and the Department of Community-Based Services. My role as family mentor is I work to engage and support families involved with the child welfare system due to parental substance abuse. Now, your question about transformation, I agree with everything that I've heard people say, and I really appreciate your enthusiasm and what you've said about being transparent, and that it involves the entire community. My input and what I would like to add and piggyback off what Lamont has said is that we need support for our social workers, our frontline workers. I do that work myself, and their secondary trauma, like you said, is very real. I don't think that workers feel appreciated, and it seems like if they do a good job, then that they get rewarded by getting more work.
Right.
And I'm going to throw in there, and I'm just going to keep it real because that's just what I do.
Please.
But for Appreciation Day, for our social workers, they had, you know, a big dinner stuff, and that's all well and good. But they had to get out and kind of drum up their own gifts to give out at so, you know, it kind of, yeah, that's what they did was like, it's like, okay, so this is more work, getting out and, you know, gathering up stuff to give to ourselves as a reward for, you know, working to tell us that we're appreciated.
Which is not an award.
Right, right.
It's not. So another thing that I would add too is that I think that we need a social worker in every school. And the more that children become, because right now they're scared of social services, they're scared of police officers.
Sure.
And the more that they see the face of a friendly social worker, the more apt they are to speak to that, you know, and tell them what's going on. If they're being abused or something like whatever's going on at home. Or if they have some basic needs that they need met, that's a good place. We don't have a social worker. I'm from Martin County, and we don't have a social worker in our schools. Another thing that I see is a lot of social workers that I've been partnered with have been trained in addictions and how to meet families where they're at, you know, because we meet them at the worst times of their life. So having them trained in that addictions and not being punitive, like you said, it's a new way of doing business. So working with the sobriety treatment and recovery team, we used to have the entire program in Martin County. I worked as a family mentor there for 12 years and just recently took the role as lead family mentor. So I won't be doing the frontline work that I did, and it grieved my soul to leave that position because there are so many families that are in need of that. So I would advocate that if counties cannot have the entire program of START, that they have a person that's in long-term recovery, like myself, from a substance use disorder. And I was also a client at one time. My child was removed because of a substance use. So I use that lived experience to help my families. I would like to advocate that if they can have the entire START program in each county, they at least would have a family mentor, a peer support person in the cabinet, because that changes the culture in that office as well.
Right.
So that's just my thoughts on that.
Thank you for your vulnerability and your honesty. I think there's an incredible amount of stigma, both about poor people, you know, as if, you know, our goal in life was to be poor and need cabinet services, and two, people dealing with a substance use disorder. So the idea that we remove children, although that parent is impaired and cannot provide the service, I agree the child's safety is the priority, but if we can figure out a way to both provide assistance to families dealing with that and create we're looking at creating some pilot programs. And this is, I'm gonna need the legislature and I'm gonna need outside funders to help us with this, but being able to keep families together where the agency takes ownership, almost like a daycare and childcare, of being able to be responsible for the child, as well as for the substance use person. So the substance use person has an incentive to stay clean while the child is not separated from the family and not necessarily being out of home care. Lots to be worked out there, but working with some folks on creating some of that. The reality here is that we know so much more now than when a lot of these programs were created. We know which ones are working. Family First is working. STAR is working. You know, transformation of a child welfare system needs to happen. You know, children's safety, without daycare, without supporting both biological and foster parents, we're not going to be able to get ahead of this. So yes, the cabinet is big, but the cabinet turned on a dime when COVID happened. So we know we can do this. Is it going to be difficult? Yes. I told my team that I was an organizational midwife, meaning we have a brand new baby to birth and it's going to get messy. It's going to get hard. People are want to get off the table. We're going to have some tough screens. However, what we'll develop is a brand new way of doing business, because the old way is not anything that we ever want to go back to. And we need your input on how to do that. So what I commit to all of you, and individually, you can email me about responses. We need to hear from you and engage more with community about how we do this work long term. As I said, right now, we're building the 6-month foundation, right? We addressed the crisis, like you said, Michelle. We kind of turned on a dime, provided resources, gave money, blew our budget, trying to support families and children, period. We needed to do that, the right thing to do. Thank you, Governor. Thank you, Secretary. Now, this is the new normal. We don't want to go back to old normal. What do we stabilize from what we learned? What's worked before? And what needs to be revolutionized and given to Goodwill and given to Habitat for Humanity, because we don't need it. It didn't work and it's too old. And let's work on redesigning that together so that we can be transparent, flexible, responsive, right, and accessible to more folks, and do that in an equitable way while we take care of our frontline workers. I've been a social worker for 47 years. My 48th year began on July 1st when I was at the cabinet. So I have an incredible passion for the profession and for the legislature. Bipartisan bills are the best I've ever seen because they take care of more people. So we need to, you know, my motto is, if you want a potluck, just meet with people who agree with you. If you want a revolution, meet with those who disagree with you and try to come up with a solution. So I am all for the revolution. I'm here. Critical feedback is really important. Really appreciative that the cabinet is ready to do some new work. I have gotten no resistance, just incredible support. And what I was told, quote unquote, if we didn't need a revolution, we never would have appointed you. So I want you to hear that my advocacy, my activism, my passion, my heart, and my 47 years of experience is with you, and that this is just the beginning of a conversation. So I would like to ask KYA if they're willing to commit, help us, or we can take that on for a 3 months panel with similar folks, the folks that are here and anybody else that's missing, so that we can give an update and continue to get feedback on a regular basis as we build back better. Any other suggestions that anyone who is here that you can either put in the chat or unmute your mic? We have about 2 minutes left. But if you have a burning desire, you say, you know, if I was sitting in that commissioner's chair, right, I need to know, or I need her to know this, or I need her to implement that. What would that be?
We'd have to have a one-on-one discussion about all that.
You what? What you say, Lamont?
I said we'd have to have a one-on-one discussion to go through all that. You don't even have time for
All
it
right,
now.
all right, you got it. You got it.
You know-
Can one of you, Shannon, or you put my email on there? Yeah, you got it, Lamont. Anybody else? Okay, thank you all. Really appreciate you. Appreciate you. Thank you, KYA, for hosting this. This is so helpful as we begin to redesign Building Back Better, and as we try to dismantle what has not worked for families and children. I am a proud brown daughter of this Kentucky, and I cannot believe this opportunity. So thank you for helping me and for being so honest and transparent. I look forward to more. Thank you.
Thank you, Commissioner. We so appreciate you moderating this panel and so appreciate all of our panelists. And we really appreciate your honesty and also being willing to be held accountable publicly. And that goes for everyone who has spoken today. And just a quick shout out to Lieutenant Governor Coleman, Senator Westerfield, Secretary Friedlander, Justice Lambert, Representative Jenkins, all of our panelists. Did I forget anybody? And of course to the 200 plus advocates who joined today's forum. And I agree with folks who are commenting and saying things in the chat that this needs to be action oriented and not just let's have a conversation and put it on a shelf. So Commissioner Miranda Straub, I think if you have said, let's talk in 3 months and see where we are, let's talk in 3 months and see where we are. Agreed.
Well, and beyond talk, because
let's check
in. So what I promise to bring back, and I'll challenge the Secretary the same way, is bring back what actions have we taken, giving your feedback and giving the Building Back Better where we are and where we hope to go, so that you see that action, but then what's coming next steps, and then continue to get feedback, so that this is an ongoing, rotating conversation. It needs to be organic, it needs to be ongoing, and you have my commitment, not only for the conversation, but from the conversation, the process, the policy, the systems emerge, and we promise to bring back what action we will be able to take.
So it sounds like we're going to have ongoing status updates and action items, and love to hear that. So again, thank you all for joining us today. Look for an email from me with all kinds of information from today's forum, including the research findings and the presentation, and a link to next week's forum, which will be about federal action needed for Kentucky and Kentucky kids and families. So thank you again. See you next Wednesday at 10, but see you electronically before that.